Yeah, and there's certainly a lot of exciting technologies coming there. And when you think about that data collection through the clinical and administrative process, it often results in a lot of defects, right? And I think that you've mentioned potentially even bringing in things like Lean Six Sigma and some other interesting approaches that I found really interesting. If you could speak a little bit about some of those kind of examples or things that you've done there.
Yeah, that sort of goes back to the concept of the workflow. So when you get more specific about it, it's really it's really important to map the world that the clinician lives in and understand that world pretty well. When you think about an emergency room visit, right? I think that you've got a patient that walks in the door. When is the first moment that you know that that patient walked in the door and who they are and what they're there for? And there's usually this period of time where there's administrative folks putting in, demographics and some data. There's a waiting period. And at each of these periods, they can be critical periods in a healthcare plan. If you've got somebody that's coming into the hospital septic or very, very ill, a lot of harm and injury can come in the periods of time where you don't know how sick a person is. And so you can take these workflows and say, all right, let me capture the workflow in a Lean Six Sigma diagram, and then begin to build the map and say, what would be the earliest way that I could know something that could be useful in beginning to protect that this patient is not here for, a more casual issue with their health, but they're there because they're very ill and they are beginning, their health is degrading while they're sitting in your waiting room. How do you start to build those pictures? And so I've done a number of those efforts before there were more advanced tools. That's exactly how I started dealing with sepsis. Is we mapped it out and then created data points along the way that would populate a visualization and sort of say, here's a person that looks like they might be septic, and that now starts a number of timers of how fast that you start doing certain elements of their care. And when those timers start,
Yeah.
then you can start to give feedback around the timers, right? Here's where you are in the timer. And that's where you can start to build the world of interaction where a tool like a data tool can become absolutely integral to the management. So I think that's what ends up happening is when you understand a workflow solidly and then understand the opportunities to collect and then deliver data around that workflow, you can actually now start thinking like you can actually be the clinician in the process and build process. So that's how I see the CMIO role. I don't know if everybody sees their role as the same thing, but I see myself as a process person, trying to create. I mean, if you look at the safety data, which in healthcare is really scary. I'm sure you're aware. Since '99, they've had reports showing that there are a lot of injuries and deaths related to being in a hospital. It's not a safe place to be, especially if you're sick. And of course, that's where you go when you're sick. And so what are the things that you can do about it? And when they start trying to find out where the system falls down is, yeah, certainly there are times where humans make errors, but it's almost always process. I would say 80% of the time there was a process that allowed that error or in some situations may have even facilitated that error being made. And those are the things that you try to do is to say I think of process while I'm thinking of data, and realizing that what I always try to tell my folks is I always think of it that there's a patient at the end of every one of the decisions that we make. In every one of those workflows, it's not just about getting the data, getting paid, delivering care. There's a patient at the end of that can be impacted by bad decision making.